So this is the first medication actually about the cardiac pharmacology. So cardiac pharmacology means the medication what we use for cardiac disease easily way. The most common heart disease or cardiac problem are hypertension. So I'm not going that way. What is hypertension? What are the sign symptoms of the hypertension? This is because this is a part of adult health, right? Or cardiac disease in pediatrics also. But here's the basic pharmacology. What are the medication we use for hypertension? That is called antihypertensive or I mean anti-hypertensive. Whatever what you like, you can ask. So hypertension means when blood pressure increase more than normal, right? Antihypertensive we use for that case. So antihypertensive lower blood pressure and also increase the blood flow to the heart. Increase the blood flow to the heart, right? So the one category of antihypertensive are, it is called angiotensin converting enzyme inhibitor, shortly called ACE, right? Angiotensin converting inhibitor. Other drugs is the same. It's called angiotensin receptor blocker, okay, or shortly called ARB. So here I said angiotensin converting enzyme inhibitor are the drugs, they work on enzyme. This enzyme basically stop the formation more fluid in the body or urine and reduce the blood pressure, right? So angiotensin converting enzyme inhibitor, the group of medication name. So if you analyze this name, you see inhibitor means the medication what something is inhibit, right? Inhibit. So what they inhibit? So let me see. A student wrote something. I has told us. She wrote how to explain lower blood pressure and increase the blood flow. Very good question. Very good question. Let me explain it first. So the medication we are talking about right now, angiotensin converting inhibitor, right? So a student asked me how this medication can work, how they reduce the blood pressure and increase the blood flow, right? But before to understand how this medication work, we have to know what are the normal mechanism of action of angiotensin or enzyme, how they stop basically. So as I told you, every enzyme is a protein, right? Every enzyme is a protein. So the kidney produces proteins called angiotensinogen. Angiotensinogen is a protein produced by kidney. Sorry, produced by the liver. Okay, and angiotensinogen convert to angiotensin 1 in presence of renin, and renin secreted by the kidney. So I am going to recap it. Angiotensinogen secreted by or produced by the liver, because this is the protein, and this angiotensinogen converted to angiotensin 1, right, in presence of renin, and renin is released by the kidney, right, and angiotensin 1 then convert to angiotensin 2, angiotensin 2. So angiotensinogen, then angiotensin 1, then angiotensin 2, right? So now angiotensin 2 has some function in the body. Angiotensin 2 has some function of the body. What they are, I said. Angiotensin 2, the one of the function, angiotensin vasodilatation, one function. Another function is the ADH secretion, and ADH basically reabsorb the fluid, I said. And angiotensin 2 also another effect on angiotensin receptor 1, they causes the vasoconstriction and also the sympathetic activation, right? So now question come. Angiotensinogen convert to angiotensin 1, and angiotensin 1 convert to angiotensin 2, and then angiotensin 2 basically when work in angiotensin receptor 1, they causes the vasoconstriction. When the blood vessel is undergo the vasoconstriction, here you can see the picture, the normal artery is dilated, and this is the constrict. So when the artery is constrict, so blood does not flow well. When blood does not flow well, the blood pressure is increased. So blood pressure is increased. And on the other hand, they're talking about the angiotensin receptor blocker when work and they stop the constriction and blood flow increase. But again, I'm going in this picture. As I told you, angiotensinogen convert to angiotensin 1. Angiotensin 1 convert to angiotensin 2, right? So if you something have stoppage this pathway, then angiotensin 1 does not convert to angiotensin 2. It is called angiotensin converting inhibitor. Again, I am to recap it. The normal body function is angiotensinogen secreted by the liver, then convert to angiotensin 1 in presence of renin. Angiotensin 1 convert to angiotensin 2. When angiotensin 2 formation, they has the effect of vasoconstriction and sympathetic activity. Sympathetic activity actually increase the blood pressure, increase the palpitation, because sympathetic system work in emergencies. What during the emergency, what happened? Our palpitation increase, blood pressure increase, eyeball dilated, right? Just imagine a big tiger running behind of you, and there are nobody can help you, no car, nothing. So you will run too much, right? Your palpitation increase, blood pressure increase. So sympathetic system is activated in case of emergencies. And when sympathetic system is activated, our blood pressure increase, pulse pressure increase, heart rate increase, right? Same time of effect occur when angiotensin 2 work on angiotensin receptor 1. And as I told you, when blood vessel is constricted, blood flow is get a resisted, right? Because of narrow pathway, blood pressure passing and blood pressure increase. But if you know how to stop this angiotensin 2, then angiotensin 2 does not work on the receptor. So no more vasoconstriction, no more sympathetic system activation. So the angiotensin converting enzyme basically block that way. Angiotensin 1 does not convert to angiotensin 2, and when they does not convert, they do not causes the vasoconstriction and sympathetic system not activated. Okay, so our medication list: angiotensin converting enzyme inhibitor means the angiotensin converting enzyme does not work. So angiotensinogen does not convert to angiotensin 1, and angiotensin 1 does not convert to angiotensin 2. And angiotensin 2 is the main factor. They causes vasoconstriction when working receptor 2 and also causes the sympathetic activity. So when you blockage this enzyme, they does not convert, and no more vasoconstriction, no more sympathetic activities, and blood pressure reduce, right? And also when vasoconstriction is off, means vasodilatation is occur and blood supply increase. So we have to know here what are the drugs we use as a angiotensin converting enzyme inhibitors. Okay, this is the drug list and generic drug name. Okay, so angiotensin converting enzyme inhibitor we use to treat the hypertension, we use for heart failure, and also we use if anybody has a kidney problem. Okay, so especially kidney problem in case of diabetic disease. In case of diabetics, we use this one. And I said that angiotensin is antihypertensive medication, especially the drug of choice we basically use. But something is important here. We should know the angiotensin converting enzyme inhibitor and I said angiotensin receptor blocker, another group of antihypertensive is shortly called ARB. Both classes associated with injury or death of the fetus. So if any mother is pregnant, the angiotensin inhibitor or angiotensin receptor blocker is a contraindicated in pregnancy. You must know, because both reduce the effect of aldosterone, which is lead to a decrease sodium or water retention and increase the potassium retention as well. So what you have to know for the board exam, the angiotensin converting enzyme inhibitor is a contraindicated during the pregnancies. Okay, during the pregnancy, it is a contraindicated. So now I'm going to talk about what are the drugs name we use as a SC inhibitor. Okay, so the drugs we use: enalapril, lisinopril, ramipril, captopril, and fosinopril or benazepril. So easy way to remember: all of the angiotensin converting enzyme inhibitor ending by pril: enalapril, lisinopril, ramipril, captopril, right? And benzapril. So end is PRIL. End of this is same one, right? So if you see any medication generic name ending by pril, they are angiotensin converting enzyme inhibitor. So here is important some common side effect and also nursing implementation. Before to go the common side effect, I want to share with you what are the nursing implementation. It is so important for LPN, it is so important for RN. So what is nursing intervention? As I told you, one, it is the contraindicated during the pregnancy, right? If you prescribed or if you monitoring your patient has to take the angiotensin converting enzyme inhibitor, okay, we always has to monitor the blood pressure because antihypertensive medication always cause hypotension, like anti-diabetic medication insulin may chance to develop hypoglycemia. We use insulin for hyperglycemia, but side effect is hypoglycemia if patient does not maintain well. Same as antihypertensive medication like calcium channel blocker or beta blocker or diuretics, any antihypertensive medication, most common or side effect, they can cause the hypotension. So monitor the blood pressure is super important, right? And as I told you, this medication has an effect on kidney because they cause the imbalance of creatinine, right? So your kidney is working or not, you has to do the kidney function test. What are the kidney function test? Check the BUN level and creatinine level. So creatinine and blood urea nitrogen, shortly called BUN, are the indicator or marker of kidney function, right? And also we should check the electrolyte balance: sodium, potassium, right? Like example, the angiotensin inhibitor like enalapril, lisinopril, ramipril, captopril can causes or lead to or reduce the effect of aldosterone, and aldosterone lead to a decrease sodium and water retention. At the same time, increase the potassium retention. So sodium, potassium, they are electrolyte. If you do not know how to control them, make a balance, they causes a big problem. So we has to check the electrolyte level. Also, WBC count, white blood cell, we should. As I told you, this enalapril, lisinopril, ramipril, captopril, benzopril, they are contraindicated in pregnancies. Okay, so now, as I told you, we has to go for side effect. So the side effect of angiotensin converting inhibitor. Keep in mind the common side effect and also what are the total side effect. Okay, the angiotensin converting enzyme like enalapril or ramipril can cause cough, dry cough, right? Or sometimes drug reaction, very bad reaction. This is called anaphylaxis reaction, hypersensitivity reaction. And also inhibitor, enalapril or lisinopril, all of this group medication called all of this side effect. Palpitation means increase the heartbeat. Orthostatic hypotension or hypotension. I said antihypertensive medication side effects is hypotension. Basically, orthostatic means when the patient change the posture, their blood pressure go drop. So as a RN or LPN, what you educate your patient, you has to educate if your patient has to take the angiotensin converting enzyme inhibitor, when they need to change the posture, like if patient is lying down, need to stand up, you tell first you lying down, has a sit on the edge of the bed for a second, then take a deep breath. Now from sitting, try to stand up, right? So if your patient is lying down, tell them to sitting on the edge of the bed for a minute, then stand up from sitting posture, not directly from lying to stand up. So if they do, their blood pressure suddenly drop, and this is called orthostatic hypotension. And as I told few minutes ago, the angiotensin converting inhibitor or ACI or ARB. ARB means angiotensin receptor blocker, ARB. Both can cause imbalance of electrolyte, like leading to decrease the sodium retention and increase the potassium retention, right? Potassium retention means potassium increase. So you have to educate your patient to take or restricted potassium containing food, right? And this can cause renal impairment. So we have to do the renal function test. How can we make it? Check the BUN level and creatinine level. They are marker. Impotency, like beta blocker. So if your patient is a young adult, reproductive age, so you don't kill their sexual life. The sex is healthy legal sex is a part of the life. So if you prescribed the angiotensin converting enzyme or beta blocker, both are causes the impotency, right? You don't kill the patient sexual life, right? We do not prescribe it. If you see somebody take and they're young, reproductive age, you have to notify to the healthcare provider. So keep in mind the beta blocker and other drugs can causes the impotency. Okay. So like metoprolol, atenolol, all of the LOL medication. So SC inhibitor also causes leukocytosis. What is leukocytosis? Increase the total count of WBC. This is the reason check the WBC is important. Sometimes they causes the GI upset, nausea, vomiting, diarrhea, or headache and dizziness. If any medication causes the dizziness, we have to tell our patient if they do some machinery work, driving the car, the activities need the alertness, right? You have to aware them before. Better to avoid it. The most frequently asking NCLEX board question, what are the side effects of this group of medication like lisinopril, ramipril, captopril, or benzapril? They causes angioedema. What is angioedema? You see the picture, the swelling of the lips. Swelling of the lips is called angioedema. Angioedema. So this is the most frequently asking the question. And also these groups of medication causes the Stevens-Johnson syndrome. Stevens-Johnson syndrome. So this is the hypersensitivity drug reaction. Very bad, right? This is the Stevens-Johnson reaction. So causes of this medication, but it is important you have to know the Stevens-Johnson syndrome, very uncommon, okay, but very serious, especially the serious disorder of the skin and mucous membrane. It is usually a reaction of a medication or any infection. Often it begins with flu-like symptom and followed by a painful red or purple rash. In the picture you can see, right? So it is important, we have to know it is very serious. If you do not know, then how you have to identify your patient have this problem. Usually a group of medication can cause Stevens-Johnson syndrome, like the drugs that can cause the Stevens-Johnson syndrome included anti-gout medication and antihypertensive like angiotensin converting inhibitor. Even I say as anti-gout means allopurinol, most common drugs we will discuss any other day. Also some of the medication treat for seizure and mental illness or anticonvulsant or antipsychotic. Okay, so I said we should know, especially angiotensin converting inhibitor, anti-gout like allopurinol, anti-seizure medication, or mental antipsychotic like anticonvulsant medication sometimes can cause Stevens-Johnson syndrome. So now question come. Easy way to remember all of this side effect, easy way, it is called AC inhibitor side effect, captopril, 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 one of the member of angiotensin converting enzyme inhibitor, right? So where this is the captopril, enalapril, lisinopril, ramipril, captopril, benzapril, fosinopril. These are all of these the drugs list ending by pril, but captopril can help you to remember all of this side effect. How? Capto, C stand for cough, S stand for anaphylactic reaction, is the hypersensitivity reaction, and P stand for palpitation, means increase the heartbeat, and T stand for taste change, O stand for orthostatic hypotension, P stand for potassium increase retention, R stand for renal impairment dysfunction, I stand for impotency, and L stand for leukocytosis, right? And two more, angioedema and Stevens-Johnson syndrome. Last question related this before to end this group of medication. If you tell me, no, it is too much for me, how I can remember more easily, or what make me short for something for me? Okay, if I tell you, if you need to make something short, usually NCLEX board, okay, give what are the side effects of angiotensin converting enzyme inhibitor, or what are the side effects of lisinopril or ramipril or captopril. Most commonly they give dry cough, or they give angioedema or Stevens-Johnson syndrome. Okay, so you must remember before to go in NCLEX board exam, they cause dry cough, not productive dry cough. They can cause angioedema, like this picture, swelling the lips, or they cause Stevens-Johnson syndrome like this. Okay, this is the medication we use as an antihypertensive or heart failure, or if patient has a kidney problem due to diabetic, we use to protect the kidney. This is the indication of angiotensin converting enzyme inhibitor. So the antihypertensive medication, right now we are talking about the diuretics. Diuretics is a way to talk. Diuretics are the medication what act on the kidney, right? Especially the kidney tubules, and excrete or expel out the sodium and the fluid. So diuretics causes excess P. So mean fluid is out from your body as a urine. When urine is too much, your body fluid is go down. When body volume go down, blood pressure go down as well, because blood pressure depends on total body fluid in the body and peripheral resistant as well. So diuretics causes the eliminate the sodium from the body eliminate from the eliminate fluid. So there are few categories of diuretics according to their location of action. We categorized diuretics like loop diuretics, thiazide diuretics, potassium sparing diuretics, right? So as I told you, the type of diuretics depends on where they work, right? As an example, I want to share with you, this is the kidney, right? Two kidney we have, and kidney connected to the urinary bladder through the ureter. We have a two kidney, I said. And this is the aorta, and this is the vena cava, means vein and artery. So renal artery and renal vein get in and out in the kidney or through the kidney. So this one kidney, we make it bigger here. So the structure, again, I said this is not the anatomy class. This is not the physiology, right? It is a pharmacology. So I just make it short description, then go in the pharmacology, more focus. So the structure of the kidney, this is called pyramid. This is pyramid. Between the two pyramid, one is called renal column. And this area is called calyx. This is called calyx. And this portion is called hilum or renal. This is specially called renal pelvis, or urine out through the renal pelvis communicate with the ureter. So the structural unit of the kidney is called nephron. This is the structure of nephron. Okay. So the structure of the nephron, as I told you, nephron is the structural unit of kidney. So the part of the nephron, they has a glomeruli or Bowman's capsule, communicate with the tubules, right? Especially this area located in the outer ear cortex, and this area inside medulla. So this loop is called loop of Henle. This is the loop of Henle, and this is the collecting tubules. Finally, urine is passing by that way. But in this picture, the glomerulus give a little bit focus. This is called the outer total. It's called Bowman's capsule. Inside the Bowman's capsule is called glomerulus. This small one, we make it bigger. Interior of Bowman's capsule, they contain glomerulus, where the blood waste materials passing and came out through afferent and efferent. So some good materials is reabsorbed, some are going through the collecting tube into the urine. We are going to focus in the different part of renal tubules where the diuretics work. There are 3 points. The structural unit of the kidney is called nephron. If NCLEX would ask, what are the structural unit of nephron? It is kidney. What are the structural unit of kidney? It's called nephron. Nephron. So nephron has some parts. The different parts, like this is called convoluted tube. proximal and distal. This is loop of Henle and collecting tubules where the arteries, so where the diuretics work, right? So if I go back in this picture, here showing the list of diuretics name. The first group is called acetazolamide. Acetazolamide. Acetazolamide basically work on the proximal convoluted tubes. This it is called proximal convoluted tubes, where the acetazolamide work. So the acetazolamide work on proximal convoluted tubes. The type is carbonic anhydrase inhibitor. So acetazolamide, as I told you from here, this is the group of medicine or diuretics work in the different part of renal tubules. Acetazolamide work in the proximal convoluted tubes. Then osmotic diuretics. Osmotic diuretics, other is called mannitol. Mannitol. Mannitol we use for if patient has any kind of brain or cerebral edema, we use mannitol, right? Mannitol basically used to get rid of water instead of sodium, and it is the best for increase intracranial pressure. So another one is called loop diuretics. Loop diuretics, other name is called furosemide or bumetanide. It is loop diuretics. Basically, the work is here. Osmolar diuretics mannitol work in this area, especially the distal convoluted tube. This is number 2 work. Distal is called descending limb of Henle, and this is the called loop of Henle, and this is called ascending limb of Henle. So the loop diuretics work in the loop of Henle. Example is furosemide or bumetanide. So loop diuretics, as I told you, loop diuretics work here, loop furosemide. So they are most effective antihypertensive, most effective or most efficient, and they work very fast acting, and can be we can give this medication oral or intravenous IV. If you give the loop diuretics, we have to watch for potassium level, because they decrease the potassium and causes hypokalemia. Also, loop diuretics can cause the ototoxicity, right? Ototoxicity means hearing problem. The chance will increase when give with acetazolamide. So they causes the ototoxicity, and ototoxicity increase if we give the antibiotic aminoglycoside, because aminoglycoside and loop diuretics like furosemide both can causes ototoxicity. The other group of diuretics is called thiazide. Number 4, thiazide. Shortly, it's called hydrochlorothiazide, HCTZ. Hydrochlorothiazide. They work in the distal convoluted tube. Number 4, so they work in the distal convoluted tube. Here, you see, this is called distal convoluted tubes, where thiazide diuretics work. So thiazide diuretics, the example is called hydrochlorothiazide, and they act on the distal convoluted tubes, and we use for chronic hypertension or slow acting diuretics. They are slow acting, but loop diuretics or furosemide are rapid acting diuretics. And also, they increase the toxicity of heart medication, right? I want to recap it. They increase the toxicity in heart medication like quinidine and digoxin. Digoxin we use for heart failure, but if you give quinidine or digoxin with thiazide like hydrochlorothiazide, they increase the toxicity. And also, thiazide decrease the effectiveness of anti-diabetic medication. So if your patient has a diabetic, if you know or if you prescribe the thiazide, you has to tell them they should adjust the doses, because thiazide can cause decrease the effectiveness of anti-diabetic agent. So what next? Next one is potassium sparing, shortly called spironolactone. Potassium sparing or spironolactone, right? So if you read the name, they are called potassium sparing. So means they retention the potassium, spirono. So in that group of patients who take the potassium sparing, the chance of hyperkalemia. So what you has to educate your patient, you has to educate to do not take potassium containing food. So also spironolactone we used orally, not as a powerful as loop diuretics. As I told you, loop diuretics or furosemide is most effective, fast acting, whereas the thiazide is a slow acting and we use for a chronic renal hypertensive patient. But the spironolactone, not powerful as a loop diuretics. And if you prescribe the spironolactone, we have to watch for increase the potassium level, because they causes potassium retention, right? And do not give to the patient with a diabetic, like thiazide. If you give the diabetic patient, they decrease the effective of anti-diabetic agent. Also, I tell you the potassium sparing like spironolactone is the best diuretics for hyperaldosteronism. It is good for the patient who are hyperaldosteronism diagnosed, or they may cause a granulocytosis. The side effect of potassium sparing diuretics, they may cause agranulocytosis. So if I go back a little bit here, so this is the structure of nephron, right? And nephron is the structural unit of kidney. So the nephron has a glomeruli and outer layer called Bowman's capsule. So in the glomeruli, afferent arterioles go inside and efferent artery get out, right? So blood go, filtrate, waste or reabsorb, right? Just blood supply. So they have a different parts. This portion is called proximal convoluted tubes. This portion totally called loop of Henle, but this limb is descending limb loop of Henle. This is loop of Henle and this is ascending limb loop of Henle. And this portion is called distal convoluted tubes. And this is collecting tubules. So the in diuretics, especially the first one, carbonic anhydrase inhibitor or acetazolamide, work in the proximal convoluted tube here. The number two, osmolar diuretics like mannitol can work here. Number two, work in that area. And number three, loop diuretics work in the loop diuretics work in ascending loop of Henle or in the loop of Henle. Here, loop, furosemide work here. Then number four, thiazide. Example I said, hydrochlorothiazide, they work in the distal convoluted tubes, right? And potassium sparing diuretics, they can work in the collecting tubules, right? And if you want something easier, okay, if you make something more easy, so first one, I am just going to little bit recap for make it easy. So carbonic anhydrates, what are the example of acetazolamide, work in the proximal convoluted tubes. Loop diuretics like furosemide, bumetanide work in the loop of Henle, especially this and this area. And then number three, thiazide diuretics, thiazide like hydrochlorothiazide work in the distal convoluted tubes. And number four, because there's a four major category I'm talking about, the potassium sparing means spironolactone work in the collecting duct. So in this picture, we do not talk about the osmotic diuretics like mannitol. As I told you, mannitol used to get rid of water instead of sodium and best for increase intracranial pressure. So if your patient has a cerebral edema, brain edema, we use mannitol, right? If your patient increase the intracranial pressure, we use mannitol to reduce intracranial pressure. Now go back in our note here, right? What we has to know for NCLEX board, and I'm going to one by one for especially we are going to give a focus on side effect, especially the loop diuretics. Loop diuretics and thiazide diuretics, these two medication causes potassium depleting, means reduce the potassium. So if potassium is reduced, causes hypokalemia. Loop diuretics or thiazide diuretics both causes hypokalemia. Whereas the potassium sparing diuretics, they causes hyperkalemia. So what you has to educate your patient, what you has to teach. If your patient take the loop diuretics or thiazide diuretics, tell them to take the food containing potassium. But if your patient has to take the potassium sparing diuretics, tell them do not take the food containing potassium containing food. Restriction, because they causes hyperkalemia. Hypokalemia or hyperkalemia both can causes dysarrhythmia. If dysarrhythmia is not treated, patient die. So what the other side effect? Loop diuretics, as I told you, the example are furosemide, torsemide, bumetanide. Easy to remember. Furosemide, torsemide, bumetanide, and ethacrynic acid. The furosemide, other most common name, what you know, Lasix. Right? We use the Lasix in gynecology and obstetrics word in OBG. So all or this group of diuretics can cause hypotension. So as I told you at the beginning, all antihypertensive medication can cause hypotension, right? And hypokalemia, hyponatremia. So sodium go down, potassium go down, right? Both. Here the thiazide diuretics. Example is the hydrodiuracil. Hydrodiuracil, or most common one we use hydrochlorothiazide, or simply say chlorothiazide. They work in the distal convoluted tube. As like a loop diuretics, they also cause hypotension, hypokalemia, hyponatremia, hyperglycemia, both same, right? Thanks God, side effect is same. And also photosensitivity. Now it is important, you has to know, you should educate your patient. If they are diabetic, if they has to take anti-diabetic agent, in the same time, if your patient has to take loop diuretics or thiazide diuretics, they has to adjust the anti-diabetic or insulin or metformin, because both of these drugs can cause hyperglycemia. Blood sugar go up. Question NCLEX board asks, if your patient are diabetic and you see the patient has to take the loop diuretics or thiazide diuretics, what you has to check? Blood sugar level. Why? Because they causes hyperglycemia, right? And also tell, if patient has to go under the sun, they has to better to use some protection or eyeglasses, because they causes photosensitivities. What else? Nursing implementation. So if your patient has to take loop diuretics or thiazide, like hydrochlorothiazide or chlorothiazide, we has to monitor kidney function test, BUN, blood urea nitrogen. As you know, they causes hypokalemia, hyponatremia. So electrolyte monitor is important. Potassium level monitoring is important. Hyperglycemia, so blood sugar level monitoring is important. Also monitor import and output. So what are the total input? It should be equal to total output, right? We have to monitor it. And frequently asking question, in case of low diuretics or thiazide diuretics, we educate our patient, take the food containing or rich the potassium. So increase the potassium in diet. So what next? Potassium sparing. So this potassium sparing just opposite the loop and thiazide. Both can cause hypokalemia, but they cause hyperkalemia. How you have to remember? The way to remember, they name potassium sparing means something retention, something take out. So they this collecting tube taking the potassium and increase the potassium level and causes hyperkalemia. Example of potassium sparing are spironolactone or triamiterene. Triamiterene. Sometimes it's called water pill. Water pill. So they can cause constipation, menstrual irregularities, or headache, dizziness, or muscle cramp. So in case of potassium sparing, what we have to know, monitor the electrolyte, same as others, monitor the electrolyte. We have to educate the patient, decrease the potassium containing food, opposite these two. So I believe that is more than enough for diuretics. So the next group of cardiac medication or antihypertensive medication are calcium channel blocker and beta blocker. The example of calcium channel blocker are here, right? Verapamil, nifedipine, diltiazem, amlodipine. My friend, if you forget your name, I will never mind. If you forget your name, we never mind. But before the exam, NCLEX exam, you never ever forget this group of name, this side effect, this group of name, beta blocker and side effect. Okay? If you forget your name, it is okay. You can show your driver license fine. But I said, if you forget them, we could not pass the NCLEX board. Okay? As I told you, the calcium channel blocker, the treatment for hypertension and angina. Angina basically is a symptom if the blood flow reduced to the heart and patient complains severe pain. If angina is untreated, they lead to unstable angina. Unstable angina lead to myocardial infarction, and myocardial infarction, if untreated, they lead to the heart failure, right? So if you treat at the beginning, you can prevent myocardial infarction, you can prevent heart failure. So calcium channel blocker is the drug of choice for the treatment of angina. But we know we also use the nitroglycerin, or shortly called GTN, right? But we will talk later on. And Beta blocker basically we use for management of hypertension, angina pectoris, angina or angina pectoris, same. But angina, I said one patient has complained severe chest pain or chest pain because of exertion. When they work, patient pain start because when work, exercise, heart need more blood pump, demand is increased, right? And pain start. Congestive heart failure and MI. So beta blocker we has to use to prevent congestive heart failure or prevent myocardial infarction. And also, as the most common use, everybody know that beta blocker or calcium channel blocker we use antihypertensive. As I told you, these two medication we are going to talk together because we will compare and contrast these two. Compare and contrast. So the name or group of the medication in calcium channel blocker, most of them are end by pine, P-I-N-E, nidafin, diltiazem, except felodipine, amlodipine, and in P-I-N-E, pine. So example are, again I say end by pine, example is amlodipine, nidipine or felodipine, verapamil and diltiazem. Diltiazem, every name is important. If you do not read now, you will forget it and you will miss your license. Where is the beta blocker? End is LOL, OLOL, lol, right? It's very popular to you. When you use the social media, we use LOL. Okay, anyway. So beta blocker ending by OLO, atenolol, propanolol, nadolol, metoprolol, and carbidiol. So most of the students make answers correct if they get atenolol, propanolol, metoprolol, but they get confusion when give the carbidiol. Same as the amlodipine, nifedipine, felodipine is fine. But when question come diltiazem, verapamil, student get confused. They do not know verapamil and diltiazem is a calcium channel blocker, right? And here I say carbidiol, beta blocker. So the mechanism of action, specifically the calcium channel blocker, if you read the name, you can get an idea. Calcium channel blocker, they block the calcium channel, block the ion calcium from crossing into the heart muscle cell. Beta blocker, it is called beta adrenergic blocker. So they work on the beta receptor. So they block the epinephrine and norepinephrine from binding to beta receptor on nerves. So beta blocker basically work on the beta receptor and they block it, right? So as I told you, the calcium channel blocker, some of the medical condition we should not use the calcium channel blocker, and this is called contraindication. What are the contraindications of the calcium channel blocker? Okay, So we should hold the calcium channel blocker if heart rate is less than 60. If heart rate is less than 60, we has to hold it. Okay. And here I can show you a picture. So in case of calcium channel blocker, as I told you, the contraindication. One is the contraindication of calcium channel blocker. We has to hold if the heart rate is less than 60. Okay. And also we has to avoid the grapefruits. Okay. Avoid the grapefruits. Another medication called carbamazepine. Carbamazepine also we has to use the grapefruits. We has to avoid the grapefruits. Okay. So if I go back here, what about the beta adrenergic blocker? We has to hold if the heart rate less than 60 as well, like the calcium channel blocker. Beta blocker now are talking about contraindication. So if patient has an asthma, we never give them beta blocker. If patients are diabetic, we never ever give them beta blocker. Super important for NCLEX board. And if your patient has to take the beta blocker, we do not use the over-the-counter medication. Okay, the beta blocker is only will increase, only use the glaucoma. In case of glaucoma, especially use the timolol. Okay, so as I told you, now it is important the side effect. The calcium channel blocker side effect are they decrease the, if I say the effect, they decrease the blood pressure, they decrease the pulse, but increase the contractilities of heart. Same as beta blocker, they decrease the blood pressure, they decrease the pulse, okay, but increase the contractility. So the effect of beta blocker and the effect of calcium channel blocker almost same. Beta blocker or calcium channel blocker both reduce blood pressure, reduce pulse pressure, okay, but increase the contractility of heart, means it is good for the heart patient, right? So what next? The common side effect of calcium channel blocker, they cause hypotension. As I told you, all antihypertensive medication common side effect are hypotension. Calcium channel blocker causes headache, they causes peripheral edema. Both ask this question. Peripheral edema. They cause GI upset or flushing, or they cause syncope attack. So flushing means increase the blood supply to the cutaneous area of the face. They develop peripheral edema as well. What about the beta blocker? So beta blocker side effect, they can cause hypotension as like calcium channel blocker. They cause bradycardia, dizziness, impotency, diabetic, and nausea. So diarrhea and nausea, GI upset. As I told you, the contraindication of beta blocker are asthmatic patient never give it, diabetic patient, and if the patient is young, reproductive age, they causes impotency. So they causes bronchospasm. So if the patient has a asthma patient has a bronchospasm. So asthma will increase. They causes hyperglycemia. So diabetic patient increase the blood sugar, right? And also they cause chronic heart failure, increase the peripheral vascular disease. Beta blocker common side effect. So if I go next here, what are the nursing intervention? So in case of calcium channel blocker, we show the if patient has developed the ankle edema on the foot, right? We has to notify healthcare provider. Or if we see the peripheral edema or ankle edema, and also it has to avoid the operating machineries, driving the car, dealing with any industrial work. We have to tell your patient to avoid it. And also avoid the grapes fruit juice, like carbamazepine also has to avoid the grapefruit juice. What about the nursing implementation in case of beta blocker? Here, we have to check the pulse before admin. If the pulse rate is less than 60, we have to hold it. Same calcium channel blocker. Right? Monitor the blood glucose level because they causes hyperglycemia. And also it is good if we give with the food. So administer with food, get a better outcome. Taper the dose to disconnected. So if you need to stop, we have to withdraw gradually. Taper dose to disconnected, right? And also, as I told you before, I want to recap it. Contraindication of beta blocker in case of asthma or diabetic patient or young adult, we never ever give them. If patient is heart block, we will not give because they increase the chronic heart failure. If that heart failure patient, we never give, right? Or any kind of peripheral vascular disease like occlusive arteries, Barger disease, Raynaud phenomenon. We never ever give the beta blockers. Okay. So